Dr. Mark Vaughan of the Auburn Medical Group. Today I'm going to go over the presidential candidates' statements regarding healthcare reform. Hopefully I'll be as nonpartisan as a person can be and go over each of their websites with their outlines for what they propose to make healthcare better in the United States if they become president. So I have some windows open on my computer, the camera's right above it, so I'll be looking down and reading along, and you can follow with me on your own computer. So we will go, and I have them open here, Hillary Clinton, Donald Trump, Gary Johnson, Eva McMullen. That's the order I'll be going through. And if you go to Hillary Clinton's website, which is hillaryclinton.com, and then click on Issues, and then when you click on Issues, you have to find healthcare, which is located in the second column over, 1, 2, 3, 4, 5 down. And I will just read through it here. As president, Hillary will, bullet point number 1, defend and expand the Affordable Care Act, which covers 20 million people. Hillary will stand up to Republican-led attacks on this landmark law and build on its success to bring the promise of affordable health care to more people and make a public option possible. She will also support letting over 55 years old buy into Medicare. Next point, bring down out-of-pocket costs like copays and deductibles. American families are being squeezed by rising out-of-pocket healthcare costs. Hillary believes that workers should share in slower growth of national healthcare spending through lower costs. Next, reduce the cost of prescription drugs. Prescription drug spending accelerated from 2.5% in 2013 to 12.6% in 2014. It's no wonder that almost 3/4 of Americans believe prescription drug costs are unreasonable. Hillary believes we need to demand lower drug costs for hardworking families and seniors. Read more here. And then there's a separate statement about how to lower costs for prescription drugs. We won't go to that at this moment. We'll keep going down. Protect consumers from unjustified prescription drug price increases from companies that market long-standing life-saving treatments and face little or no competition. Hillary's plan includes new enforcement tools that make drug alternatives available to increase competition, broaden emergency access to high-quality treatments from developed countries with strong safety standards, and hold drug companies accountable for unjustified price increases with new penalties. And again, read more on this separate statement. Fight for health insurance for the lowest income Americans in every state by incentivizing states to expand Medicaid and make enrollment through Medicaid and the Affordable Care Act easier. Okay, this is the first time I'll stop and throw in a little comment. And what I think of when I think of the Affordable Care Act and expanded Medicaid is that there are a number of states that still do not have expanded Medicaid because they did not participate in the Affordable Care Act monies that were made available for the expanded Medicaid. Usually it's states with Republican governors that chose to not participate because in order to receive the money, they would have to do certain things with their Medicaid programs, including expanding it. So the people who would have gotten insurance through that in those states that would have been Medicaid eligible are not getting what was envisioned as how the Obamacare or Affordable Care Act would have been enacted. So I'm not totally clear on how that's going to be made to happen in those states if Hillary Clinton was to become president. Next, expand access to affordable health care to families regardless of immigration status. Hillary will expand access to affordable health care to families regardless of immigration status by allowing families to buy health insurance on the health exchange regardless of their immigration status. And that's not currently the case in the Affordable Care Act. You do have to be a citizen to get insurance through the plan. Expand access to rural Americans who often have difficulty finding quality, affordable health care. Hillary will explore cost-effective ways to make more health care providers eligible for telehealth reimbursement under Medicare and other programs, including federally qualified health centers and rural health clinics. Telehealth is something that's happening in rural areas. Generally, it will happen at some kind of a government incentivized or just plain government health facility where television with cameras set up and use something kind of like Skype that's secure, so that a specialist in a more urban area can work with some kind of a healthcare provider like a nurse practitioner or a physician assistant who's there with the patient, and then they can consult and provide care that would be similar to that as if they had the patient in their office. So it's a great way to expand regionally what you can do with healthcare, and that's already starting. She's talking about expanding that. Defend access to reproductive health care. Hillary will work to ensure that all women have access to preventive care, affordable contraception, and safe and legal abortion. Double funding for community health centers and support the healthcare workforce as part of her comprehensive health agenda. Hillary is committed to doubling the funding for primary care services at community health centers over the next decade. Hillary also supports President Obama's call for near tripling of the size of National Health Service Corps. And then I'm supposed to read the fact sheet, so I'm going to click on that. We'll go to the fact sheet and read through it. So when you click on that, you get something called The Briefing, and the title of this one is Hillary Clinton's Commitment: Universal Quality, Affordable Health Care for Everyone in America. The Affordable Care Act was a critically important step toward the goal of universal health care, offering coverage to 20 million more Americans and ensuring all Americans will never be denied coverage on account of pre-existing condition or their gender. Today, 90% of all Americans have health insurance, the most in the history of our country. I will point out here, of the two other candidates who speak about the Affordable Care Act and what they would do to change it, Donald Trump's plan does not include any kind of conservation of protection for pre-existing conditions or gender. If he intends to have it, it's not clear on the website. I was looking for specifically that and couldn't find those things. And then Evan McMullen mentions that he does want to preserve the good things in his assessment of the Affordable Care Act, and for him that is the protection of patients with pre-existing conditions. He does not specifically mention gender, but he does say other things that were good about it. The only one he specifically names is pre-existing conditions. He may also include protection for gender equity in the premiums for healthcare. Despite this progress, Hillary believes that we have more work to do to finish our long fight to provide universal quality, affordable health care to everyone in America. This starts by strengthening, improving, and building on the Affordable Care Act to cover more Americans. First, Hillary will work with governors to expand Medicaid in every state so that access to care no longer depends on where you live. It is a disgrace that 19 states have left 3 million Americans without health insurance because their states have refused to expand Medicaid. It is wrong that Republican governors and legislators are leaving too many Americans without health insurance, even though they qualify for coverage. Hillary will launch a national campaign to enroll people who are eligible but not already enrolled. She will expand access to affordable health care to families regardless of immigration status by allowing families to buy health insurance on the health exchanges regardless of their immigration status. Second, Hillary will get health care costs under control so that those who have health insurance can afford the health care they need. She will not stand for unjustified health premium increases. She will make sure the Secretary of Health and Human Services has the authority to block or modify unreasonable health insurance premium rate increases so that coverage is more affordable. I have some concerns with that, and that is, much of the country thinks the health insurance companies are the bad guy, but it is true that a private company will cease to exist if it can't generate enough revenue to have a profit to make it worth it to stay in existence. So I'm a little concerned about where controlling the rate increases is going to, what effect is that going to have on private companies. Hillary has comprehensive plans to address increasing out-of-pocket and prescription drug costs. She will cap prescription drug costs that people have to pay out of pocket. and limit excessive out-of-pocket costs for families. And Hillary will work on long-term solutions to reduce consumer costs of prescription drugs so that these drugs are affordable for all while not stifling innovation that produces life-saving and life-extending scientific breakthroughs. That's quite a balancing act. Third, consistent with her previous proposals on public options, Hillary will pursue efforts to give Americans in every state in the country the choice of a public option insurance plan and to expand Medicare by allowing people 55 years or older to opt in while protecting the traditional Medicare program. Okay, when I read this about the public option, which I actually think would be nice to have in addition to the private options, since we're kind of losing the private options, and also expanding of Medicare to people down to age 55, 10 years younger. I love that. I think for my patients, that sounds wonderful. I will say as a taxpayer, I'm concerned as to where is the money coming from. Hillary has also laid strategies to address multitude of pressing health challenges, from Alzheimer's to autism, mental health and substance abuse, to public health infrastructure and environmental health, to women's health, all the way through Zika. As we advance toward the goal of universal health care, Hillary believes we must do more to address the lack of access to primary health care, dental care, mental health, and affordable prescription drugs. One critical component of establishing universal primary care is to expand our proven system of federally qualified health centers. Today, 25 million people in the United States get their care from these community health centers each year. We must significantly expand that coverage so that every American, regardless of where they live, has good quality primary health care available to them at a cost they can afford. The Affordable Care Act significantly expanded mandatory funding for FQHCs as part of her comprehensive health care agenda. Hillary is committed to doubling the funding for primary care services at community health centers over the next decade. In doing so, we will dramatically expand access to millions more people. This means extending the current mandatory funding under the Affordable Care Act and expanding it by $40 billion over the next 10 years. I am not seeing where that $40 billion is coming from in this statement. Hillary also supports President Obama's call for a near tripling of the size of the National Health Service Corps, which will increase funding to $810 million in 2017 and grow over time to $1.3 billion by 2027. Again, I see huge numbers. I don't see where it's coming from. I do believe that's addressed under her tax plan changes. That's something that has to be taken into consideration along with healthcare issues when you decide what candidate you want. I'll try to focus more just on the healthcare. It's very hard to separate it from how it's going to be paid for, though. I just have to throw that out there. These are good investments for patients and for taxpayers. Today, community health centers save more than $1,200 per person per year. This is a savings to the overall healthcare system of $49 billion each year. And by allowing people to access health care when they need it, we'll avoid costly illnesses, hospital stays, and trips to emergency rooms. There's some truth to this. A healthier population also means fewer missed days of school and work. In sum, working toward providing universal primary care to all Americans by investing in community health centers will save billions in unnecessary healthcare spending. It also means billions in healthcare spending. Together, these steps will get us closer to the day when everyone in America has access to quality, affordable healthcare. So it really seems like the goal is not to spend less money. The goal is to have universal healthcare. Everyone having some kind of insurance plan. That is a big goal. That is very ambitious. Also, it would cost a lot of money, especially in today's healthcare environment in the United States, where healthcare is very expensive right now. Let's go to one more thing on the Hillary Clinton website, because there was a link to it in the actual issues page, and that was when it says read more here under the cost of prescription drugs, and also a couple other sections. This is titled, it's also under something called the briefing, and this one is titled Hillary Clinton's plan for lowering prescription drug costs. Hillary Clinton believes we need to get incomes rising so American families can afford a middle-class life, but too many American families and seniors are being squeezed by rising drug costs, even as they have seen their wages and incomes grow far too slowly for years. This is an issue that affects every American family and individual. Every month, 90% of seniors and around half of all Americans take a prescription drug. A typical senior on Medicare spends over $500 per year out of his or her own pocket on prescription drugs, and individuals with chronic health conditions or serious illnesses can spend thousands of dollars each year in out-of-pocket spending to afford the prescription drugs. The largest pharmaceutical companies are together earning $80 to $90 billion per year in profits at higher margins than other industries, while charging Americans thousands of dollars for new drugs, often at much higher costs than in other developed nations. They're receiving billions of dollars in taxpayer support for basic research, but spending more on marketing than R&D. Americans are having a hard time paying the bill. According to a Consumer Reports survey in August, 1 out of every 4 people facing higher drug costs were also unable to afford medical bills or medications. 1 in 5 said they missed a payment on a major bill. Again, there's a major value of economics tied in with this healthcare reform. What they're getting at is somehow restricting profits for private industry. That would be very good for costs of prescription drugs. Some of them are ridiculously expensive, although I cannot say that it didn't cost that much to get the research and develop into it. I can say it didn't have to be marketed to the patient on daytime television. Hillary Clinton believes we need to promote competition and leverage our nation's bargaining power to lower drug costs on behalf of Americans. Hillary Clinton believes that we need to hold drug companies accountable to lower drug costs for Americans. And this isn't a new fight for her. She fought against special interests for affordable health coverage in the 1990s and as a senator. In her 2008 campaign, she called for allowing Medicare to negotiate with drug companies to reduce prices and rein in costs. She's been committed to this fight throughout her career and is continuing it today. That's why Hillary Clinton is announcing a plan to hold the pharmaceutical industry accountable and rein in drug costs for American families. Her plan will demand a stop to excessive profiteering and marketing by denying tax breaks for direct consumer advertising. I didn't know they had tax breaks for such a thing. And demanding that drug companies invest in R&D and in exchange for taxpayer support rather than marketing or excessive profits. They're implying that the drug companies are taking money that the government's giving them and spending it on marketing instead of research and development. I would not like for that to be the case if it is. She'll encourage competition to get more generics on the market and create a federal backstop for when there are excessively high-priced drugs that face no competition. I like the sound of that. And for Americans struggling with prescription drug cost burdens, she will cap what insurers can charge consumers in out-of-pocket costs, putting money back in the family wallet. Okay, a little bit of, we're not done here, but just a little bit of background for you guys as far as costs. I can say that overall, in my practice, more money is spent on drugs than is spent on at least the primary care doctor. Now, I don't know if that's necessarily a bad thing. For reference, I wanted you to be aware of that. Hillary Clinton will demand a stop to excessive profiteering and marketing costs by encouraging innovation and new treatments from drug companies. Her plan will stop direct-to-consumer drug company advertising subsidies for this, and reinvest funds in research. Almost every country in the industrialized world bans or severely restricts direct-to-consumer advertising because it increases prescription drug costs and can include confusing, misleading, or incomplete information or exaggerated claims if not regulated effectively. Okay, I agree 100% with that. Clinton's plan would eliminate corporate write-offs for direct consumer advertising, saving the government billions of dollars over the next decade. She would use the proceeds to help invest in research by devoting the funds to help pay for making permanent and simplifying the R&D tax credit. And going forward, Clinton's plan would establish a mandatory FDA pre-clearance procedure for these ads funded through user fees paid for by pharmaceutical manufacturers in order to be sure the ads provide clear and understandable information to consumers. Yeah, I've got a real problem with the direct-to-consumer ads when the ads cannot be interpreted by a lay person on their own. You have to have a physician's level of medical knowledge to go over these ads what they're promoting, what they're treating. Many patients are educated through, like in my case, I'm thinking of patients that go to a specialist who oversees their health care for a particular drug that's been advertised on television. And usually they're very knowledgeable on it, but it's through being seen by the specialist, and myself too, that they have this knowledge about their condition. I would prefer for them to learn about the medicines from myself or the specialist, because if they're appropriate for them, we will discuss them. Oftentimes, I do not discuss brand new medicines for patients because I wouldn't recommend them simply based on the cost. I start with generics first, almost always, because for the great majority of conditions in patients, that will be adequate. Okay, moving on to more. This is really long. Hillary Clinton will lower costs for Americans by limiting out-of-pocket spending, increasing competition, and demanding value for their purchase. Cap monthly and annual out-of-pocket costs for prescription drugs to save patients with chronic or serious health conditions hundreds or thousands of dollars. Americans should be able to afford prescriptions for the conditions throughout the year and not have to stop taking a needed medication. Right there, I need to stop, because I actually do have patients who get into this thing called the donut hole, where their prescription benefit will go up to a certain dollar amount, and once they exceed that, the patient has no longer prescription drug coverage, and usually it hits, it seems like for most of them, somewhere in, well, of course, it's going to be more of them as the year goes on, but it's like around this time of year. Here we are in October, and they find, oops, for the next 2 months, if I want to take my such and such drug, I'm going to have to pay for it myself. And of course, the alternative is taxes. Pay for it. And when I look at their medicines and I see that a specialist has prescribed a non-generic medication that a generic would have been adequate for, this does happen, I switch them. And then we decide if we're going to go back on it come January 1st, based on how the patient has done during this time from October through December, because it's economically the only option. And sometimes we stay with the generic that costs less anyways. So again, this is something in healthcare that often comes up, and I'll state it here. You have a disconnect with our current system between the consumer or the patient and the cost. They don't know how much the visit to the doctor costs. They don't know how much the visit to the specialist costs. They don't know how much their prescription drug costs. They don't know how much their MRI costs. That's not a free market. You don't have law of supply and demand occurring when they have no connection to the cost. And the reason they don't is because they're not paying the bill. In fact, they probably can't even find what it actually costs if they were to look at the bill, because there's discounted payments for the insurance compared to if they actually were paying it out of pocket. Of course, then if they were paying a cash price, they could probably negotiate a discount. I know people can negotiate a discount with me if they're paying cash, and they can with some of the local imaging centers and hospitals. But then there's some of them that won't negotiate because they're just so big. There's not a person in a place to speak with the patient to negotiate with them. This is with the larger organizations. Sometimes, of course, there's larger organizations that are very good and very charitable too. I don't mean to say big is bad. Okay, moving on. Increase competition for prescription drugs, including specialty drugs, to drive down prices and give consumers more choices. Hillary Clinton's plan will increase competition for traditional generics and generic versions of specialty drugs such as newer biologics. Clear out the FDA generic backlog. Clinton's plan will fully fund the FDA's Office of Generic Drugs to clear out their multi-year generic drug approval backlog, which has kept competitors off the market and can help lower overall prescription drug prices. If this is true, I am all for it. And I do know about the generic backlog. I don't know that it's because of FDA approving things. I was always under the impression that as soon as a drug goes generic, it takes time for competition to tool up their factories to put out something that's competitive with it. And it's a slow process. If there's only one competitor, the price will not necessarily drop that much. It takes more than one competitor to have enough competition to get that price down substantially for the consumer. If it is because of a backlog in the FDA approving these generics, then yeah, I'm all for making that happen. That would be a wise spending of our tax dollars. Increase competition for specialty drugs, including new biologic drugs, which are often the most expensive new treatments, especially drugs such as biologics, have provided new treatments and improved health for people suffering from chronic illness such as rheumatoid arthritis, Crohn's disease, and multiple sclerosis, and people suffering from serious illnesses such as cancer. Yes, I can say these are expensive drugs. I do have some patients taking them. But often these drugs are the only ones on the market with no competition to keep the price down. Drug companies can charge excessive prices. Clinton's plan will increase competition for new treatments derived from biological sources and by encouraging generic versions. Lowering the biologic exclusivity period from 12 years to 7 years will spur greater competition and save up to $5 billion for federal government over 10 years. Okay, this is a very important point to discuss. Shortening the patent from 12 to 7 years. That is a significant limitation and limitation of incentive for a drug company that's making these new technologies. Will it affect our ability to get these drugs, the availability of them and just the making of them in the first place? Well, when it comes to availability of them, when they cost too much for us to use, is it worth allowing them to keep that? So it would be really nice to shorten. Of course, if you shorten it and it really is expensive for them to do the research and development, then they got to cram all that profit into a shorter period of time. That's an incentive for the drug cost initially to be even higher. So I do have concerns about squeezing the research and development to the point that we're making it not affordable. On the other hand, as I just stated, if it really costs that much to develop them with our current technology, maybe it's not worth us spending those dollars on those treatments. And it's hard for me to say that as a physician who wants to treat patients, but there are some things that are really, really expensive where you have to make a choice of what you're going to spend your money on. Hard decisions to make. Okay, moving on down. Prohibit pay for delay arrangements that keep generic competition off the market. Hillary Clinton would prohibit pay for delay agreements that allow drug manufacturers to keep generic competition off the market, lowering prices for Americans and saving the government up to $10 billion. I guess that's true if when they pay for delay, they're not paying $10 billion. Allow Americans to import drugs from abroad with careful protections for safety and quality. Hillary Clinton believes that it's unfair that drug companies charge far lower prices abroad for the same treatment while imposing higher prices on Americans. Countries in Europe often pay half of what Americans pay for the same drugs. Clinton would allow Americans to safely and securely import drugs for personal use from foreign nations whose safety standards are as strong as those in the United States. The FDA and other regulatory agencies would set careful standards for reimportation to ensure safety and quality for Americans. I think that would be a wise way to spend tax dollars also. Ensure American consumers are getting value for their drugs. Clinton's plan will ensure that new drugs coming on the market provide value and high quality to consumers rather than adding to costs without improving treatments and outcomes. Clinton recognizes that new drugs can constitute incredible breakthroughs in treating disease from hepatitis C to cancer to heart disease, and we need to ensure that there are proper incentives for real innovations that bring effective products to market. Clinton believes that Americans should not face extreme costs or pay too much for drugs that do not, in actuality, improve on available treatments. She has a long and strong record of supporting the evaluation of the value, quality, and comparative effectiveness of new drugs. That's why she'll build on provisions in the Affordable Care Act that invest in private research and other private efforts to use the results of private sector analysis to hold drug companies accountable for justifying their costs and ensure Americans pay drug prices that reflect the improved value new treatments provide. This is a very real issue of drug companies having studies that make it look like their new drug is better than the current standard, and in reality, it's not significantly better. They can prove what we call statistical significance, which does not necessarily relate to clinical significance. So there's a real issue there. The trick is, with all the influence of the lobbyists from the drug companies and the way that they do their research that can be very hard to see through to the reality of it, having the right people making the decisions. You need very qualified scientists that know how to read the literature, are very familiar with it, and these people are around to help make these judgments. And it is a judgment. It's not going to be a simple thing to determine. Although Hillary Clinton will leverage America's negotiating power as a backstop, where competition alone isn't enough to hold pharmaceutical companies accountable and drive prices down. Hillary Clinton's plan would leverage America's strong bargaining power to demand higher rebates and lower costs from drug companies. Her plan will demand higher rebates for prescription drugs in Medicare to contain the cost of prescription drugs for low-income individuals, people with disabilities, and seniors. Hillary Clinton's plan will require drug manufacturers to provide rebates for low-income Medicare enrollees that are equivalent to rebates in the Medicaid program. Under current law, the rebates offered in the Medicaid program are more generous than those offered in the Medicare. Hillary Clinton would require pharmaceutical companies to provide higher rebates in the Medicare low-income subsidy program, ensuring that rebates are at Medicaid levels. This would save more than $100 billion in Medicare costs. That sounds good. Allow Medicare to negotiate drug and biologic prices. Hillary Clinton has long believed that Medicare should use its leverage with more than 40 million enrollees to negotiate and drive down drug and biologic prices for seniors and others in the program. Today, drug prices in Medicare are negotiated by a disparate set of benefit managers rather than using the full bargaining power of the program. Clinton believes that we should drive the best bargain for Americans, and especially for senior citizens, by allowing Medicare to negotiate drug prices, notably for higher cost drugs with limited competition. So what she's talking about here is all the Part D plans. Those of you with Medicare know what I'm talking about. The way that you get your drug benefit is from one of these private Part D. There are a lot of them, and having it separated out over all of these different pharmacy benefit managers makes it so that you guys can't collectively bargain against the drug companies or negotiate with the drug companies. She's talking about a government-run Part D. I know a lot of people don't like the government getting into something that's in the private sector. We have seen that Medicare has been able to collectively bargain, essentially, because it just simply gives you a contract, and if you want Medicare patients, you accept the Medicare rate. And in this situation, there would be something similar. If the drug company wants to be the drug for Medicare, they will accept what Medicare is willing to pay them. As a physician, I kind of don't like that that's been done to physician salaries. I'm sure drug companies won't like it either, but I will say it's effective at controlling costs. To do this government-run thing of something that currently is private and has many people competing, but not getting a better price in their competition, it would be better for the consumer if they could all bargain together. Again, it's that issue of, do you want to give to the government a certain degree of control and a part of the industry in exchange for lower costs? And in this case, I do believe it would result in lower costs. I do believe that Medicare results in lower costs for healthcare than private insurance. I am a big believer in the Medicare system. Okay, so that sums up some of my comments on the Hillary Clinton plan. We went over 3 different web pages that they have, all linked from hillaryclinton.com. Overall, it is a lot of spending money to provide health insurance not only to all legal Americans, but also to undocumented immigrants. And then these are things that involve much more than just health care. I do find that there does seem to be a lot of plan and thought to the Hillary Clinton proposal. It certainly has been thought through. I think there's a lot of intelligence behind it. I think that in thinking of healthcare in your voting for a presidential candidate, it's a large part of it is going to be based on some philosophy about whether or not you believe in increasing taxes to pay for more people to be covered and offering health care to even more Americans. We will also do a video on Donald Trump, Gary Johnson, and Evan McMullin. Look for those coming up. In fact, there will be a card right over here that you can click on to get to the next proposal. Thanks for your patience. Thank you for watching. Please do comment in the comment section below.